So our second speakers of this session are from our American Cancer Society. So between Blood Cancer United and American Cancer Society, we have 75 and about 110 years of patient support and advocacy experience. So today for American Cancer Society, we have Jasmyne Watts and Kline here, and they're going to be speaking on voices of Black women as in regards to a groundbreaking study led by the American Cancer Society to understand and improve the health of Black women across the United States. And they're here to report on this research so we can learn more about this experience.
All right, so the last presentation really was a great segue into where we're going now. So Holly and I will let you know all the things that are going on with Voices of Black Women at the American Cancer Society, how we advocate for African-American women in these sessions, and then also the next level that they're taking this to. So I'll just start with a personal caveat. So I, Jasmyne Watts, as the patient, started a journey with blood cancer probably like 4 years ago now. And so my experience, even though I work at the American Cancer Society, been there for 6.5 years, I never understood, like I would hear the stories, but you don't understand until you get in those rooms and then you feel the story, right? So I had a mass that I had been seeing for a while that I had noticed probably since before the pandemic, and I just was like, oh, it's nothing, it's nothing, it's nothing. But it was hanging right here in my face. And so I go to an appointment with my ENT, and she was phenomenal. She says, I don't even know you, haven't met you, haven't seen anything, but that thing right there is coming out. And I'm like, wait, what? I'm turning 30 this year, like I'm going on vacation, I have all this stuff planned. She said, listen, we're gonna do it, take the vacation, we'll do it right after vacation. Soon as she does it, my chart informed me that the notes came back and it read, well, it reads in all this cancer jargon, but I understand that, right? So I'm like, oh my gosh, I have cancer. This is 6 o'clock in the morning. I had to go the whole day before I have a visit with her. So when I get to the office, well, before I got to the office, she and her office called me a couple times because I think that they noticed what had happened. It wasn't their fault, right? But to a patient, that can seem so harsh, so hard. You have to like live out that day knowing what you have to face in a little while. So when I got there, she brought me to the back and she was like, Jasmyne, I'm so sorry. Nobody should have to hear this from an app. And so, we talked about it and she fast-tracked it, and then I went and met with an oncologist the exact same day. This oncologist was so rude to me. She asked me, well, so what's your diagnosis? And I'm like, you didn't see it in my chart? Like, even the nurse understood what was going on. And so it was very hard to understand. And at first, the human part of me wanted to like go off and cry and, all these things. But I was like, get it together, get it together. So she left out the room. When she came back, I said, I work for the American Cancer Society. Like, now I'm flexing my muscles. And this is what I need. I need to know what's going on and what kind of aggressiveness this cancer has or what steps I need to take. And so she paused for a second because she didn't expect me to say that or do that. Because the first couple of questions that came in was, what level of education do you have? And, a lot of other things. And I knew that this stuff went on, but not had the experience. And so when that's fed to you directly, then you have a different impact. So I'll say that forever changed my life. I met a phenomenal oncologist after that, after flexing my muscle and meeting different people at the MD Anderson clinic, hospital. So yes, and she is great, and she does everything I need and then some. She listens to me. If I say I don't want to do this, we don't have to do that, Jasmyne. What do you think you need? It's all these different things. So I say all that to say, going in and having an experience like that made me want to drive this out even more and then get to see on the other side what this is about. So at the American Cancer Society, we have several different patient pathways. Prevention and early detection, diagnosis, barriers to care, care planning, treatment and support, patient navigation, clinical trials, which this is what Voices of Black Women is a part of, smoke and cessation wellness, caregiver support, and survivorship. And the next, I'll let you hear this video that we have.
So I'll start by saying that speaking in front of large groups of people is not my favorite thing to do, but I am passionate about voices, and so that's why I choose to share. I just wanted to, I guess, tell you a little bit about how I first really learned about the American Cancer Society and also why I chose to be a participant in this study. My mother is a 24-year breast cancer survivor, and it was in the early 2000s, the year after my mother was diagnosed, when I first learned about a Making Strides Against Breast Cancer event, which is one of the American Cancer Society events that's done throughout the country. That's when my journey with the American Cancer Society began. About 5 years after that, I decided that I wanted to get more involved and volunteer with the organization in a bigger way, and pretty much since then, I've been volunteering in one role or another. When my mother was first diagnosed, this was a scary time for both of us. She was a single parent, and of course, as a mom, one of her biggest concerns was what would happen to me if something happened to her. She was my go-to person. She was one of my main supporters, and so she was the person who held things up for us. So as you can imagine, her diagnosis tore us apart emotionally. Because of that experience, I understand how important it is for cancer patients, thrivers, previvors, survivors, and caregivers to have a network and also to have resources. It's important for patients to have services such as rides to treatments and places to stay when they have to go to doctor's appointments that's far away from where they live. And the American Cancer Society is an organization that works to improve the lives of cancer patients and their families by offering this type of assistance, in addition to funding research, which is very important. So when I learned about the Voices of Black Women study in 2024, and I was asked to be an ambassador, of course I looked into the details and goals of the study, but for me it was easy to respond with a yes. The ambassador role allows me to interact with people in the community, to share information about the study, and also to share my why. Not only did I say yes to being an ambassador, I decided to be a study participant as well because I understood the potential impact. Because Black women have not historically participated in these types of studies, it's possible that the detection methods and treatments may not always be as effective for us. As a molecular biologist, I know that not all cancers present the same, especially at the molecular level. Understanding the causes of cancer, cancer progression, resistance to treatment, and recurrence is necessary for being able to develop appropriate detection methods and treatments. As a Black woman, it feels good to know that the American Cancer Society cares about what I have to say. Because I've worked with the organization for so long, I know that it's an organization that I can trust. And furthermore, the American Cancer Society has led other population studies in the past that's provided information that has influenced policy. So it was a no-brainer for me as a scientist and a Black woman to join this study. The amount of time that it takes to register and do the initial and follow-up surveys is very little, in my opinion, compared to the possible future generational impact of this study. So I implore you to think about the information that was and will be presented today, to share the information, and to consider being a participant, if eligible, in this study, which is aiming to improve the lives of Black women through better understanding. For me, being able to share my voice is powerful. I can't expect someone to know about my biology and my lived experiences if I'm not a part of the equation. We should tell our story. The impact of this study not only affects women, but all of the lives that women touch. There are lots of people who are affected when just one woman is diagnosed with cancer or another major illness. So let's be a part of progress. Thank you.
And so stories, ambassadors, mentors who are out here in the community sharing what American Cancer Society does, clinicians and physicians doing the work. It's imperative to make sure that we are letting people know what is going on, what work is being done. And so our vision, of course, at the American Cancer Society is to end cancer as we know it for everyone. And of course, through our mission to help improve the lives of those people who have cancer and their families, and through advocacy, research, and patient support to ensure everyone has an opportunity to prevent, detect, treat, and survive cancer. So at the American Cancer Society, we have a three-pronged approach to improving the lives of cancer patients, and so it's all listed out here with our discovery pillar, the advocacy, and patient support pillars. So a lot of work that we do is about, of course, fundraising and goals that we are trying to deliver to ensure that the patient's needs are met. Conduct some of the world's largest population studies, so we have those volunteer participants with that. We do advocacy, as Alice already said, in all 50 states. And then the patient supports, 111 million plus lives touched per year. And that's growing as we see day to day, from direct patient support to prevention screenings, lodging, transportation, navigation, survivorship, and education. And the Voices of Black Women really helps to drive that as well by collecting that data and being able to share it out. So the leading research for decades, there were cancer prevention studies that we've hosted at the American Cancer Society from the beginning of 1952 to 1955. And then some people in the room may know about the CPS studies because we ran those in 3 separate cohorts. And then now we're on to the Voices of Black Women study. And so with this study, this is a study that we are trying to make sure we get those 100,000 participants within the first couple of years. So it began in 2024 to a small group of states, and now it's open in all 50 states as well. So ACS has been leading population cohort research for over 70 years, and over 2.5 million people have participated in these population cohort studies. So, of course, leading research for decades, there were landmark contributions in understanding smoking and cancer, including the risk estimates for every Surgeon General's report on tobacco and health since the first in 1964. Significant contributions to air pollution and health, leading to changes in EPA regulations, advancing understanding of the role of postmenopausal hormone use and gynecologic cancers in women, significant contributions to understanding body weight, physical activity and sedentary time impact cancer risk. So identifying or validating every known common genetic variant for breast, prostate, and pancreatic cancers, and then also the landmark study on weight loss and breast cancer. So there's a lot of different prevention studies that ACS plays a part in. Advocacy do a lot of work within that. So as you all know, getting rid of the smoking ordinance, the tobacco ordinances inside public places like the casinos and different things like that, these studies have helped get us to that level. So making decisions that changes lives. So category description, what we invest in, ACS to staff, volunteers, and funding, tools, partnerships, and evidence-based models. So on a day-to-day basis, what we do at the American Cancer Society, especially in the community partnership area, we do practice evidence-based interventions with community health systems, with community hospitals, and with private hospitals as well. And then what we offer is our cancer screening initiatives and support, of course, the transportation and lodging that I talked about before, patient navigation, and clinical trial support. Also a community-based center care and one-to-one support. And we deliver thousands of lives touched through these services on a day-to-day basis. And how do we change and what do we change? More patients have access to these services, higher patient compliance and early detection, fewer missed appointments and gaps in care. And then what we sustain is reduced suffering and improved outcomes, empowered patients and caregivers, as well as scalable donor-supported programs. So our 2026 cancer facts and figures have been presented already. So you'll be able to scan this QR code and it'll take you to that list. So of course, in the United States, 44% of the estimated 626,000 cancer deaths in 2026 can potentially be prevented. So these facts and figures come from a number of different things, and you'll be able to see everything through there. And I'll leave it up for a second for people to scan the QR code. It's a great report, by the way. See a few more cameras up. Okay. Got it? Okay. All right, and so this is some facts pulled out from 2024 with Black and white women disparities in cancer, well, male and female, I'm sorry, cancer incidence and mortality. So you can see within these how the difference in the variance of it. So if you look at the first blue marker at the top for the incidence from 2016 to 2020, the 449.3 in white women versus 409.9 in Black women. And then if you go down, you'll be able to, that's all sites. But if you start going down into a lot of the different things, you'll start to see how it differs. So like colon and rectum is a little bit higher in Black women over white women. And then like you go down uterine cervix, it's a little bit higher in Black women over white women. And it's going to differ in a lot of different parts. And that's the thing about the voices of Black women. So kind of with the blood of society, am I saying it right? I'm so sorry. Leukemia, it used to be leukemia, lymphoma. I'm so sorry. Blood Cancers United. There we go. So what they talked about earlier, so, you know, people do receive these diagnoses, but it's a matter if you can afford it. Do you have the lifestyle that can take care of it? Do you have a reserve of funds, or, you know, maybe you're a single parent, have to take care of a whole household? So organizations like us, we help to bridge those gaps. So health disparities among Black Americans, the overall life expectancy is lower for Black versus white individuals. For women, 77.9 versus 81 years old, and then for men, 71.5 versus 76.1. And in 2016, death rate in the U.S. was higher for Black than white individuals for most chronic conditions. So we also have to look at that too, right? These chronic conditions coupled with the cancer diagnosis or incidence, that really adds to it, right? Because there are a lot of other barriers that come in within that. So a large-scale cohort of Black Americans would have substantial value of this beyond cancer, right? Collectively, Black individuals have the highest death rate and shortest survival of any racial ethnic group in the U.S. from most cancers. So engaging Black women in research is key to improving Black women's health. Black women are less likely to participate in clinical trials, what Dr. Porter already talked about, have access to the latest screening and technology, and then receive a local stage diagnosis. Many of those reasons can go into a lot of underlying factors that are within the social determinants of health as we know it, and then other barriers that come in as well. So including Black women in this research has been a crucial step, and then the voices of Black women will be the largest ever population cohort study aiming to better understand cancer risk and cancer outcomes among Black women. So I just jumped ahead. Social determinants of health, here we are. So these play key factors in our drive these disparities. So, you know, why does the U.S. Cancer health disparities exist? One, environmental factors. And us in Louisiana, we know a lot about environmental factors, right? Behavioral factors, that's another thing. And that also plays a part in, you know, it has tobacco use and diet and excess body weight, but it also plays a part in what we do on a regular basis for our jobs, you know, these different arenas that we may work in, career, trades, you know, you notice a lot of different things in different career paths. The social factors, so education, income, employment, health literacy. And then clinical factors, access to healthcare, quality of healthcare. So as I explained my story to you earlier, I feel like if it wasn't for me working with the American Cancer Society already, I would not have had that advantage of some of my counterparts or someone else. People call me all the time and, you know, share their experiences. I went to, you know, a conference in I think she was an MA, but she was sharing an experience of one of her friends went to this same doctor and they didn't receive the same treatment. And so her friend was Asian and she's Black. And so she was like, this person just basically tried to tell me, oh, I'm just coming here to get pain medication versus trying to hear what was going on with me. So we see a lot of different things like that. So then you have your cultural factors and cultural beliefs, and then psychological factors. Stress and mental health play a big part, and we're seeing an uptick in that part as well. And then you have biological and genetic factors as well. So understanding which combination of factors contribute to which disparities will facilitate our understanding of how to eliminate them, meeting the people where they are. And this is where this model comes in, you know, looking at all these different pieces of the pie to try and help those individuals around us. So the path to engaging 100,000 voices of Black women is This is an older slide, so it opened for those orange states back in 2024, but now it's open to everybody. So they're recruiting women ages 25 to 55 and can have no cancer history and reside anywhere else, anywhere in the U.S. now. But the reason why they're looking at this no cancer history because they want to see how it affects those people around them. So the survey is 5 minutes. The informed consent takes about 20 minutes. Registration for the survey is about 10 to 15 minutes. Life and health history of the survey is about 60 to 90. And then there's a 2-year follow-up. I have not taken the survey myself because I cannot participate. But I have watched others take the survey, and it doesn't quite take as long. Holly, what would you say?
So there are a lot of questions, but you don't have to answer all of them. It depends on your comfort level. If you answer all of them, it could take you an hour, hour and a half, but you can stop and start along the way and pick it up as as you have time.
Yes, you can log in and log out as needed. So the content on the Life and Health History Survey covers standard content in health studies, so demographics, insurance, healthcare, cancer screening, medical conditions and medications, vitamins and supplements, family history, reproductive health, and occupation. And a lot of people look at it and they go, why are they asking me, do I relax my hair? But that plays a part into those environmental factors or, products that you might be using on yourself that's contributing to those things. And then like behavior and lifestyle information. So your alcohol and tobacco use, the diet and diet environment, physical activity and built environment, sleep and fatigue, personal care product use, as well as some new components they have. Mental health, which I think everybody in this room can attest that is necessary. Quality of life, the stressors, social support, education, racism, and discrimination. So how can you get involved? If you're eligible, please join in the discussion. Share information with colleagues, patients, and anyone in your families. Discuss engagement opportunities with our team at ACS, myself, Holly, or Alice. Become a Voices Ambassador. And you don't have to be a Black woman to be a Voices Ambassador. And then learn more about Voices of Black Women as well at voices.cancer.org. And thank you for helping us end cancer as we know it for everyone. And then I have 3 more resource slides. So we also have some additional resources at the American Cancer Society, the CAR T cell therapy treatment resources. This is really, really good. If you have, you need a good visual or patient education flyers or different resources for caregivers and everything, these are some really, really good tools. All right. And then we have a patient navigation credentialing program called ACS Lion, which is a really great opportunity. There's an informational flyer and you can register for this, but the program is now available and it's free. And then it has live proctoring is no longer required. So you watch some videos and it does an assessment. And then there's a Spanish language option that is soon coming, as well as some other languages. And then the last slide is after a cancer diagnosis, patient education. So these are some really good tools as well. So it has these, quick reads for patient one-pagers that share information, what to expect before, during, and after their treatment, as well as it can connect them to our 1-800 number where they can call and have access to resources, which we do on a very rotating basis. There was something that was going on for food and nutrition resources that happened earlier in the year. They were giving patients assistance there. So we are always doing different things like that. And I think that's my time. Any questions?
Actually, can I
Yes,
say,
sorry.
3
Come right.
things?
Come right.
One, I wanted to add that while the participants in the studies cannot have cancer, that excludes basal and squamous skin cancer. So you can have that and be a participant. I also wanted to clarify that when we say a Black woman, that could be biological, but that could also be someone who's not biologically born female, but who identifies as a woman. And the other thing I was going to say is that as far as the research the ACS funds, if you're interested, they have all that information with abstracts on the ACS website.
Thank you. Thank you.